Good evening, everyone. Thank you. Good evening, everyone. My name is Julia Frankston Morris, and I'm a member of the Robin Nyman Mikveh Education Fund Programming Committee of the Mikveh Emunah Society of Greater Washington. We are so proud to have hosted a series of events this year with support from the OU Women's Initiative. Back in April, we were awarded an OU Women's Initiative 2022 Challenge Grant for innovative women's programming. Our Women's Unity Series grant program is entitled Engaging and Connecting Women in Our Community at All Ages and Stages of Life. Events from this past May through the coming December have each targeted different audiences while highlighting our shared commitment to community and to family. In the chat, you can click on a link to a summary of all the events that have taken place or are upcoming. We're proud of the events we've put on and feel privileged to have coordinated these events for women accessible locally, around the country, and the world. Our next event will be an in-person celebration in Silver Spring, Maryland, around Hanukkah time. For those who didn't know her, Robin Nyman, Aleha Shalom, was the manager of the Wallerstein Mikveh here in Silver Spring before her patira 3 years ago. She was a renowned mikveh educator and a dynamic teacher and social worker who transformed the experience for women going to the mikveh throughout the country. With the blessing of the Nyman family, in 2020, the Mikveh Emunah Society established the Robin Nyman Mikveh Education Fund to honor her memory and perpetuate her legacy. Since its inception, our committee has planned and presented numerous programs addressing Hilchot Taharat HaMishpacha, marriage, pregnancy, child rearing, women's health, and more. If you missed any of our past events, recordings are available on our website. Tonight's topic is particularly special because this was a topic of passion for Robin. She cared tremendously about educating women about menopause and the challenges it brought, physically, emotionally, and halachically. Like all women's health issues and their intersection with halacha, Robin strived to educate women with sensitivity and honesty, and in her memory, we've endeavored to do the same in all of our programming. Before we get started, here are some housekeeping items. We've placed all participants on mute. The panelists will be taking questions at the end of the program. To submit questions, place them into the chat. Only Chai Chin, who's running tech, sees who submits the questions. We'll be putting a link to the post-event survey in the chat now so that you can fill out the survey at your convenience. We ask you to fill it out so that we can continue to make our events responsive to your interests and for a chance to win a $25 Amazon gift card. We'll repost the link later as well. We're really privileged tonight to be joined by Audrey Siegel, who will serve as moderator. Audrey moved to Silver Spring 30 plus years ago, where she and her spouse have raised their children. Audrey taught for many years locally before she began serving as executive director of Beaker Cholam of Greater Washington in 2005. As executive director, Audrey was responsible for making sure services fit the organization's vision, meet the community's needs, and ensure that its systems run smoothly and efficiently. Audrey's passionate about connecting with people of all ages and stages and working with others to envision and develop programs that help create a more compassionate and just world. Without further ado, Audrey, over to you.
Hi, everyone. Like Robin, Aleha Shalom, tonight's topic is also a passionate interest of mine. In my professional work, I strive to coordinate support and care for people with all different kinds of need. I commit to giving dignity to those experiencing challenges and alleviating stresses in the lives of people with so on their plates. Like many medical issues that women face, it sometimes feels like this life cycle is at best ignored or diminished by the whole range of professionals that women might reach out to. And at worst, so many women envision this stage of life as entirely negative and dreadful because of the way that media and our society at large depict it. One of the goals of tonight's program is to reshape that attitude and present a positive perspective to menopause. And I feel strongly about women availing themselves of as much information that is out there for them to improve their lives. And lucky for us, we have just the right women tonight to explore this with. 3 women, all professionals in their fields, perfectly poised to help us understand the intersection between menopause and health, medicine, and halacha, and intimacy. Starting with intimacy, Suri Halpern is a licensed marriage and family therapist, as well as certified sex therapist with a private practice for individuals and couples in Ballackinwood, Pennsylvania. She has lectured extensively to mikveh attendants, rebbitzins, and yoetzet halachot, as well as kala teachers. She is passionate about giving women the support and information about sexuality at all life stages. Michelle Klein is a practicing gynecologist with Capital's Women's Care in Silver Spring and also Laurel, and she's a part of the Potomac Orthodox Jewish community. She practiced obstetrics for 20 years and now focuses on gynecology and preventive care from adolescence to geriatrics. She's board certified, a fellow of the American College of Obstetrics, and a member of the National Menopause Association. Bracha Rutner is head of school at Central Yeshiva University High School for Girls and teaches Gemara. She also serves as Yoetzet Halacha for the Kent Mill Synagogue in Silver Spring, Maryland. She combines her passion for helping others and her commitment to halacha in all of the various positions that she has. Ladies, thank you for being with us here tonight and for sharing your expertise to help educate us all. One of the statements that jumped out at us in our pre-talk conversations was how you all express a passion for helping women. Can you tell us about your journey of how you came to be doing what you do professionally and when you realized that helping women was a particular passion of yours? Let's start with Bracha.
Thank you so much, Audrey. It's really an honor to be on a panel with Michelle and Suri and to be speaking at an event honoring Robin. My whole life, I've had two passions, helping others and learning Torah. Not thinking that education was part of my life, little did I know, I looked for ways to marry these two passions. And when I learned of the Yoetzet Halacha program, I knew that this would enable me to learn deeply, to use my knowledge to help others. It was not an easy journey. When I first met Rabbanit Chana Henkin and applied to the Yoetzet Halacha program, pouring out to her why I wanted to be a part of the program, she actually told me no. She said that at that point in my life, I was young, I needed to go learn more, and I needed to gain more life experience. And that would make me a much more passionate and much more sensitive Yoetzet Halacha. It was hard to hear those words, but a few years later, after I followed her advice and was accepted into the program, I really thanked her. Never did I imagine that the experiences I would have, the journey that I would go on with the women that I have worked with over the years, through their dating years, marriage, children, and ultimately menopause, supporting them when I could, when relationships didn't quite work out, when they experienced miscarriages, or when they struggled with infertility, and the halachic questions that they had, and the changes they experienced during the different stages of life. I know I've personally been inspired by a lot of the women that I have worked with and learned so much from them. Being a high school educator at this point in my life has really given me a unique view on the value and impact on education, and really the ability to have somebody to ask questions to. I remember once one of the first callers that I had, who was a woman who was post-menopause and had a needed question, one that she had kind of put on hold because she'd never asked a question before in her life. And it struck me how she had medical professionals that she really felt comfortable turning to, but she didn't have halachic professionals, halachic figures that she really felt comfortable. Here I was, a little bit late in the game, able to help her really navigate her situation. And this has really stayed with me through the years. The need for women to know that they have someone that they can turn to, somebody who can guide them in this very private area of their lives.
Thank you, Bracha. Michelle?
I want to just repeat what Bracha said. Thank you so much for having me on this panel this evening. So my first experience actually trying to, or at least figure out what I wanted to do and what I wanted to focus my life on, I was actually in the 6th grade and we had to do a research paper, and I chose to do it on women's suffrage. And even at the ripe age of 10, it stuck in my head, like, why are women treated differently? Why don't we have the same rights as men? And this kind of just reverberated in my mind. And as I went forward in high school, I knew I had an affinity towards the sciences. That was what motivated me. Those were the courses I did best in. Physiology was what was most impressive to me. So as I went on to college, my focus was anatomy and physiology. My most memorable course was an embryology class that I took, and I had to take it during the summer because it was worth too many credits, so it wouldn't fit into my regular coursework. So I stayed on campus a summer, didn't do anything else, just so I could take this embryology class, and actually got to see cells dividing under the microscope. And I fell in love basically right then and there. And I started doing research, and the fellow, the postdoc fellow that I was working with, he said to me, you know, Michelle, you're applying to graduate school for anatomy, which is what I was doing at the time. And he said, do you really want to do this? And I was like, well, why are you saying that? He goes, you love teaching, you love being involved with people, you love talking to people. I think you should apply to medical school. And this was like out of the clear blue. I was like, what, are you kidding? Why would I apply to medical school? This is, I love anatomy and physiology. And he said, I'm telling you, you're going to find more doors open and you're going to be more passionate about what you're doing. So I did. I applied to medical school. And then the next hurdle was deciding what field to go into in medicine. So by the time I had to make that decision, I had already had our first child. I was a 3rd-year medical student when I had our eldest child, and I had to take a leave of absence from school because I got very, very sick at the beginning of the pregnancy. And they told me I either had to take an entire year off or no time off at all. So I took half a year off before she was born and half a year off after she was born. And it was my first real experience to what a high-risk pregnancy would be like, because I had never really experienced that. This was obviously my first pregnancy. So I still really, really wanted to go into OBGYN. And I was really nervous about how I was going to possibly blend having a family and being observant and being on call every 3rd night and staying up all night and forfeiting my weekends. So I went to meet with the doctor who was responsible for the residency program, who happened to be a woman and happened to be a mother. She wasn't Jewish, but she did have 2 out of the 3 criteria for me. And I went to meet with her and I said, I'm just really struggling here. Like, what should I do? And she said, Michelle, you're passionate about this field. You can do whatever you put your heart and soul into doing. And that was it. I mean, I went home and I changed all my applications. I was signed up to do pathology, and I changed everything and applied to the program. I was at GW here in Washington. We were living here at the time, still are. And that's what I ended up doing. And so I practiced obstetrics for 20 years. And during those years, the most amazing part of it, and such a humbling experience, is that you are part of someone's life in the most meaningful and their most vulnerable time. And to be able to share that with them and help them navigate the difficulties and the beauty that they're experiencing was just wonderful for me. And then after doing that for 20 years, for personal reasons, for my family reasons, I decided to stop practicing obstetrics and really, really focus on my gynecologic practice. And, as you can imagine, most things that we do in routine, well exams are healthy visits. And those are wonderful. And I get to bond with my patients, and we catch up with our families and what they're doing and how their life is, and talk about, next steps and what to anticipate. But some of the real challenging moments and the times that I found most satisfying for me professionally has been to help people navigate challenges and new diagnoses that they've had to cope with, and trying to figure out next steps. And it may not have even been a gynecologic issue. I had a lovely, lovely patient who is no longer with us. And she came to see me, and she brought her CT scan with her. And I said, this is not my specialty, but what can I do? Well, how can I help you? So she had a CT scan done because they couldn't do her colonoscopy. And as I'm reading the report of her CT scan, I said, okay, well, this part is okay, but what are they doing about the nodule in your lung? And she said, what nodule in my lung? And had she not brought the report to me, I wouldn't have, been able to point this out to her. Anyway, she ended up having lung cancer, which was an incidental finding, and no one had talked to her about it yet. And sadly, she passed from the lung cancer. But I felt that I was able to help her cope with this new phase and to be able to deal with this horrible diagnosis for her. And she really came to see me just because she wanted my opinion, even though it wasn't my field of expertise. And I had always said to her, if you have any questions, just call me, let me know. Anyway, so that's kind of how my journey has been, full circle. And I just feel that it's just been such a privilege to help women navigate these changing cycles in their life, because nobody goes through more changes in a lifetime than women do. I mean, when you really sit down and think about it, right? I mean, we have puberty, and then we have reproductive years, and we have pregnancy. And then after all that's done, then we have menopause and all the challenges that go along with it. And I don't think anybody else goes through that. So anyway, that's my story.
Yeah. Wow. Thanks. Thank you, Michelle. Suri, tell us about your journey.
Sure. I also want to say thank you for letting me be a part of this really wonderful program. I deeply appreciate you asking me. And just to tell you quickly, I started out my career as an attorney, and I was working with people in divorce mediation, and I took a long hiatus from the practice of law to raise my family. And I thought, well, maybe I could get in there and try to help people before they get to the point where the marriage is over. And I decided to become a marriage and family therapist. And I had the privilege of working alongside a very experienced person for a year. I was an intern, he let me sit in on his cases. And a whole year went by, and he never inquired about the couple's sexual connection or lack thereof, anything. And I thought, oh, I need to get some training so I can be comfortable asking people about their sexuality. So I did the training, and then I was asked by Project Sarah, which is this wonderful program in New Jersey, if I would speak to college teachers in Lakewood about pornography, about how to deal with pornography. They were coming up as an issue in the film community, and what college teachers should tell colleagues and how they should work that out. So I was preparing the talk, and I thought, this is a great opportunity to talk to women who are on the front lines, really as sexual educators, right? And they're such a huge resource for women. I don't want this presentation to be all about pornography and dealing with religious men who struggle with that. So I made that a part of the presentation. And then the rest, I kind of added things just about female sexuality. And the women in the room were so fabulous. They were serious and open and responsive. And that began a process for me of doing these presentations and trying to get some more education out there. And yeah, that's kind of why I'm here.
Thank you so much, Suri. Okay, Michelle, back to you. Let's talk about menopause. What is it medically? What are some of the really common symptoms, the less known symptoms? Please.
Well, that's a lecture all in and of itself. I mean, that's a series. However, let me just focus on a few important points. I'm sure this group of people who are listening in have an understanding about it, but I'm just going to mention really, really briefly. Normal menstrual cycle. Day 1, period starts. Day 14, and this is again the average person. Day 14, ovary releases an egg. That's called ovulation. The body produces progesterone. Progesterone increases and then decreases. And that decrease in progesterone is what induces a normal period. So that's the regular cycle. So before you can really talk about total menopause, we have to address perimenopause. And perimenopause is probably more difficult for people to really comprehend because there's so many variables with women in general. So it's generally characterized by a decreased frequency of ovulation. And so what we see then is you still have estrogen levels that are pretty normal and sometimes even high, but the progesterone has dropped. And because there's no progesterone, we're not having a period. But the estrogen is still stimulating our uterus. And so we can have increased tissue forming in the cavity of the uterus, in the endometrium. And that can lead to all the annoying symptoms that people complain about: the heavy period, the bleeding between periods, the missed period, and then the period that lasts 2 or 3 weeks and can't stop. Now, along with that, because hormones are fluctuating, you can begin to have some of the classic symptoms of menopause, such as classic number 1 is hot flashes, insomnia, night sweats. Then following that, sleep disorders, because these hot flashes are waking you up all the time. And then all the consequences that happen from sleep deprivation, mood swings, weight gain. These all continue to fold into themselves. Now, menopause itself is the true diagnosis of menopause is no period for a year. However, during that time, if one has a period, that's okay. But once the year from that last menstrual period has hit, that's when we call it full menopause. And one should not have a period anymore at that point. Now, the elephant in the room is hormone replacement therapy. Everybody talks about hormone replacement therapy. Am I a candidate? Am I not a candidate? There was a Women's Health Initiative study that was done in 2001, and it was designed decently, but not great. And it had tens of thousands of women in this study. Now, the reason I say it wasn't great is because the one question that practicing gynecologists wanted answered to, they didn't even address, and that was quality of life. Gynecologists are not prescribing hormone replacement to improve your bones or to help reduce heart disease, decreasing your cholesterol. Those are better treated by internal medicine docs, and they have many other medications to treat it. But the real reason that women seek attention for their menopause is because they have these hot flashes. And so sadly, the Women's Health Initiative in 2001 never addressed it. Well, fortunately, there have been collaborations of different societies that have looked at some of that data since that time and have now come up with really usable guidelines in terms of who's a candidate and who's not. Now, just a few things about it. There are obviously some women who cannot take hormone replacement therapy, right? There are absolute contraindications to hormone replacement therapy. And then not everybody needs it. Not everybody wants it. And that's fine too. I think that we all have had friends who either suffer tremendously with hot flashes or, like my best friend, she had one hot flash in her whole life. And that was it. And she was done. And I was like, are you kidding me? That's it? But so it never even crossed her mind to use hormone replacement therapy. Now, the one symptom that I think is really important to talk about, and I think other women on this panel will probably discuss it too, but genital urinary syndrome of menopause, also known as vaginal dryness. So that is the one symptom that does not dissipate over time. Hot flashes, if you don't treat them, eventually they will go away. They'll decrease in frequency. You'll be able to cope with them more. Some women have it for more prolonged periods of time, but by and large, even if you didn't treat it, they'd eventually go away. But the vaginal issue is pronounced, and it can go on for a longer period of time. And what's important to note is that there are receptors for estrogen that are in the vagina, but also in the lower part of the bladder. And so women in menopause can have symptoms of urinary frequency, feeling like they have to go to the bathroom all the time. They might have more bacterial and yeast infections because the vagina can't fight off those bacteria and yeast as well as they used to. And of course, intimacy becomes very difficult, either penetration vaginally or even responsiveness sexually, because the tissue in the vagina loses its elasticity. It also then, number one, is painful, and number two, just doesn't have the blood flow that it needs in order to be able to respond sexually. So that's menopause in a nutshell.
Okay, thank you, Michelle. Suri, turning to you. What kinds of concerns are you seeing with menopause? What are women coming to you with?
Okay, so I would say the number one issue that's appeared in my practice is the loss of desire. That has been the primary concern. I think that sexual pain, that shows up in my office in young women. I think more mature women take that concern to their doctor, is my guess. Which is why in sex therapy, what I generally see in mature women in their 40s, 50s, older is I used to have a great libido. My libido was my buddy, and now it's gone. And that is so upsetting to people. And it brings up a whole host of questions. Like the first question that I hear is, does this mean I'm not attracted to my partner anymore if they're in a partnered relationship? It's like, I just would rather watch TV. I would rather read my book. And so it's really, that part is really a struggle. So if you walk away with anything from me tonight, one thing I want the women on the Zoom to know is you are totally normal. This does not make you abnormal, and it does not mean you don't love your partner anymore. And there's a lot of things you can do. There's a lot of things you can do to help with desire. I'd like to talk a little bit about some of those things, if that's okay. Audrey, yeah? Okay.
That is okay.
Okay.
Thank you.
Okay, so there is this idea about responsive versus spontaneous desire. And responsive desire is where my desire kicks in response to something else. Spontaneous desire is if I'm just walking down the street and I think, wow, I would love to have sex tonight, right? Or I just get a sexual thought, and it can be just kind of hitting me. And there are many women that have spontaneous desire, but there's been a lot of research on this, and the majority of women have something called responsive desire. So what that means is it's in response to their relational context. It's in response to how they're feeling about their partner. It's also in response to how they're feeling about themselves. So biologically, for women, a lot of times, in order for your brain to kick in and say, hey, this is a good idea, this is something fun, and I should do it, my body needs to send a cue to my brain. So I have to have some physiological arousal in my body that says, cues my brain and says, keep going, this is going to be fun, this is a good thing. Does that make sense? Right? So in order for me to say, I want to engage in some kind of sexual behavior, I need a cue from my body that says, this is going to be fun. I need some level of arousal for desire to kick in. Arousal is a physiological feeling in the body, and then for desire to kick in, I need to have that happen first. So it's a catch-22, right? Because if I need to have my body turned on in order to have desire, what's going to get me to say, okay, I'll give it a try, right? How do I jump on the tree to have this happen? So in sex therapy, there's something we call a willingness window, which is that if women understand that they are biologically wired to be this way, then they can say, oh, you know what? Maybe I can have a willingness to see if I can get turned on. That's like a willingness window. And for some women, it's open wide, that willingness window. They're willing to give it a try. For other women, it's a crack, and their partners are always encouraging them to push that window up a little bit. Come on, let's see. The number one complaint we hear in heterosexual relationships from men is that she never initiates, right? But biologically, it makes sense that women don't initiate because they need arousal to precede desire. And in menopausal women, this is much more of a struggle. So there has been some wonderful research coming out of Canada by this woman, Peggy Kleinplatz. And she wrote a book called Magnificent Sex, which if you get a chance to read it, it's really interesting. And basically it explores like people who describe that they have magnificent sex. What is it about? How do they get there? And for menopausal women, the answer is fabulous, because it is not about sexual acrobatics, and it's not about hanging from chandeliers. It is about a deep feeling of connection with your partner. And the book talks about empathy, but not in the sort of common way we describe empathy. It's a deep, empathic attunement to the other person, so that your sexual partner is also your best friend, and also attuned to what makes you feel good and what doesn't make you feel good. And as people are together longer, there's more freedom to share what this feels good, this doesn't feel good. And to have the ability to have your partner tell you that what felt good 6 months ago doesn't work for me anymore, and not be devastated by that, but be like, okay, that's cool, right? We can, in menopause, expand our definition of sexuality away from a very limited box of penetrative sex, because your whole body is capable of pleasure, every part of you. So in menopause, you get a chance to experience that whole range of sensory feeling and pleasure, and explore ways of feeling close and feeling sexual with your partner. The one thing that she does say, and I think this is very important, which is sometimes if people are saying, you know, I just am not in the mood for sex, I don't want to have sex, right? So it's having a sexual experience that's worth wanting, right? Because if we have fun and then there's pleasure, it's a cycle of, I want to do that again. So to take the focus away from frequency and have the focus be on quality, on the quality of the connection. And I think probably the most important thing is to maintain your sense of humor, right? And so if you have an experience and it doesn't go well, welcome to the human race, right? We all have experiences that sometimes are, that was dud, right? And if someone tells you they've never had that, they are not telling you the truth. Okay. But that's not what's shown in the movies and on TV. And but we really have an opportunity as we get older to slow down and experience our senses with our partner in a completely new and vibrant way. And yeah,
Oh, thank you so much, Suri.
okay.
All right, Bracha, you're up next. Let's talk about menopause and halacha. What kind of concerns are women coming to you with? What are you hearing? And what do you discuss?
Sure. So looking back and thinking about the questions that I've had over the years, I categorize the questions into two. One, and they both encompass a lot of different areas. One of the number one questions I get are women who, as Michelle mentioned, longer periods with more staining in between. I cannot tell you how often that question comes up to me and how frustrating women feel that they feel that they're in nida all of the time. They either find that they can't start the Shevan Kiyam, the 7 blood-free days, they can't get through them. And so the first thing I always tell a woman is, has she reached out to her medical provider? Because as Dr. Klein was saying, it may be helpful to handle or be responsive to some of the halachic issues actually in conjunction with a medical professional to figure out if there are halachic solutions for the questions that a woman has. Is there a medical solution as something combined together? That's one of the areas that's very important for the yoatzot. I often learn the most from the women who call me, but that we have continuing education. As Suri mentioned, she does speak to the yoatzot, and we are constantly keeping up with our information. We're not medical professionals. At the same time, it's important for us to know so that we can guide women properly to go ahead and be in consultation or be in conversation with their medical professional. At the same time, I find that when women call me about staining issues, either because the Shevan Kiyam are so difficult to get through or to start, or women isn't sure, I always find that it's very helpful to do a review of what the difference is from a halachic perspective, of the difference between what is considered staining and what is considered actually nida and a flow. Sometimes it can be individual. There are women who can have certain types of amounts of bleeding that for them might be considered a flow, whereas for someone else it might be considered staining. So there is always, with every question that I get, certainly a personal element, which definitely does impact a situation. And I think that that's very important when a woman asks a question, especially in menopause, especially when she's can feel especially frustrated, is to provide as much personal information as possible, because that personal information can ultimately impact the answer that I give the woman, or that any the rabbis that we consult with go ahead and give a woman, provide a woman. One of the things that's very important that I think it's important to go ahead and review, and this is certainly relevant for a woman who's going through, who's perimenopausal and may be frustrated, and also can be relevant in other areas and other times in life. One of the most important questions first is the bleeding uterine? And that is, sometimes there can be cervical bleeding, sometimes there could be vaginal bleeding. It's important to distinguish and to know the difference. And sometimes, as we mentioned, as Dr. Klein mentioned, in terms of vaginal dryness, sometimes if a woman is having intercourse, that can actually cause the bleeding, and she might think it's uterine, but it might not really be. And so it's important to go ahead and determine that and to know if it's uterine or not. One of the next questions that's important to know is what she's seeing, is it red or brown? Because, and what a brown is, there's always that question, but it's important to distinguish, because sometimes a woman can have excessive staining that may prevent her from beginning the Shevan Kiyam or counting the Shevan Kiyam, or she might even consider it her period, and it might not actually be, because it might be brown. And that's something that's very important to go ahead and ask. Find someone you feel comfortable showing whatever you're seeing to. And I know for some women that is not so comfortable. We try to make it as comfortable as possible for all women to do it. We could do it anonymously. However a woman is comfortable, we try to make her comfortable to go ahead and ask that question, because that can be a huge difference. I've had women who have shared with me that they've had staining, then it keeps staining, and then when I see what color they're actually experiencing, it's brown. And it's not a problematic brown that would necessarily prevent a woman from starting her Sheva Nekiyim. So that's something that's very important to go ahead and ask. Another question is also, what is she seeing it on? Is she seeing it on toilet paper? Is she seeing it in the toilet paper, colored under white underwear? I know very recently I had a question where a woman said she saw a tremendous amount on toilet paper, and it actually, in her mind, it was a lot, but it actually was not so much. And in general, we tend to be more lenient when it's on toilet paper or in the toilet bowl. And also, I always tell women, if you're not in Nida, go ahead and make sure you're wearing colored underwear. You could even put on a liner, according to most opinions, and that can be very helpful for a woman. The only time she should be wearing anything white is during the Sheva Nekiyim. And I will say that it's important to go ahead and ask and mention details, because sometimes there may be certain leniencies with that also. Again, personal situation that we have to take into account, the personal details, but it's just important to know what surface that she's seeing it on, because some surfaces may not be a problem that she's seeing it on, even if she's seeing red. And that's why it's important to go ahead and ask that question, and to even ask the question. Sometimes I find in life, we get tripped up by, we don't know what we don't know. So the more that we're educated and the more that we're informed, I know that I often ask women these questions. I also think it's important for a woman to go ahead and think of any details. I often will go through my questions and say to a woman, do you have any other information that you want to share? And that information is so important. Even a seemingly insignificant detail, or a detail that a woman may view as insignificant, may actually really not be so insignificant. And I think it's important for women to know that when they go ahead and ask a question. It's also important for us to know the size of the stain. We usually use the reference of a size of a penny. I know never is staining the size of a perfect size of a penny, but it's important to go ahead and discuss and to know that the size also matters, so that a woman might see a red stain on her underwear, but if it's within a certain size, it might not necessarily be a problem. And certainly, as I mentioned before, can the stain be attributed to anything else? Would it not be uterine? Could it even be something that might be due to a medical procedure, which I'll talk about in a moment, that might not necessarily be a problem? It's important to go ahead and ask that question. Now, there may be times when a woman has a lot of difficulty getting through the Sheva Nekiyim, and it might be that in some situations, we might also reduce the number of bedikot, or the number of internal exams that she has to do. That's a personal situation that we would need to go ahead and consult, but it's important for women to also know, just to ask the question, would this be a situation? Is there anything else that I can go ahead and do? If every other area that we have pursued might still be a challenge. So I think it's important to go ahead and review this, and to go ahead and to know the questions to ask, and to know that not all staining makes a woman in nida. And that's really important to know, to go ahead and ask the question, so that a woman doesn't assume. I have many women, I find women tend to err more on the side of caution and be stricter on themselves. I know I have a woman who calls me often, who says to me, you know what, I think I'm just going to wait a day because I'm not sure. And my response is, why do you need to wait a day if halacha doesn't require you to? There's no need to add. The halachic system is already created to be strict. And so when we can be, we try to go ahead and implement leniencies within the system, so that Taharat HaMishpacha is within the halachic system and not overly stringent. And sometimes when we add stringencies, it can create greater frustration. So to know that we don't always need to be so strict on ourselves, and that sometimes what we interpret to be the letter of the law might actually be beyond the letter of the law, and we might be being stricter on ourselves than is necessary. Another common question that I get, more so for women who are perimenopausal, is women who are going through certain medical treatments. They might experience more polyps. They might experience, as Dr. Klein was talking about, more buildup within the uterus of tissue, and they might need to have procedures because of that. What's also important to know is that a woman goes through a medical procedure, a gynecological procedure, it doesn't necessarily mean that every procedure that she has is going to put her in nida. There certainly might be situations where she is, but there might also be plenty of situations where a woman is not. And here too, I always find it very helpful for women to go ahead and ask questions and provide as much information as possible. One of the main, or two of the main factors that are important when a woman is going through a medical procedure is, will the uterus be dilated or not? And what type of instrument will be used and what size that instrument is. It can make a very big difference to have all of the information as to whether a woman is in nida or a woman is not. I usually, when a woman calls me, I have a checklist that I give her that she should go ahead and ask her doctor when she is planning medical procedures, so that we have all of the information before. I find with Taharat HaMishpacha, it's often easier to be more lenient, or to provide women with better guidance when we're proactive, when we have the information in advance. So you're going in, excuse me, to the medical procedure, knowing what to expect from a medical perspective, and also knowing what to expect from a halachic perspective, so that we can take whatever precautions that we need beforehand, and we're not surprised. There may be surprises that come up, which is why it's always important to go ahead and even to ask a question following up. But it's important to go ahead and to know the information beforehand, so that when a woman does experience a medical procedure or undergoes a gynecological procedure, we already know in advance, in general, what we're going to expect and how the woman should proceed before the procedure, during the procedure, and after the procedure from a halachic perspective. And that goes, I find also when women know and they have knowledge, they feel more empowered and they actually feel more comfortable, because I know what to expect. I know what questions to ask, and they feel much more comfortable going into whatever procedure they're going into. And in general, my approach with when women call me is that I want them to feel empowered, and I want them to feel educated, and I want them to feel knowledgeable, because they really need to know what's going on in their bodies. They need to know what's happening to them and have a full understanding, so that they can fully appreciate it and feel. Sometimes when you're going through this situation, there's a feeling of a loss of control. I don't know what to expect. I don't know what's going on. Every month feels different, and I feel very confused, and it can be very frustrating. The more information and the more knowledge that women have, the more control they feel over a situation that really is not necessarily within their control. And I always encourage, ask questions, don't make assumptions. Also know that so many other women are going through the same situation, or have. I know when I call women, I say, oh, I just had a question like that yesterday. They feel a sense of relief of, oh, I'm normal. This is normal. I think, Audrey, you mentioned that at the beginning. The other people are going through this, and I feel more comfortable now because I know that other people have gone through this and they've experienced it. Again, ask questions. There are people available for halachic questions, for medical guidance, for intimacy guidance. It's just important to know that there are so many resources out there, and women should not make assumptions about what the next steps will be, because I feel that that doesn't necessarily always work in their advantage in terms of their confidence and their comfort in this challenging time that they're experiencing.
Thank you, Bracha. I want to turn to you, Michelle, now and pick up on what Bracha was just finishing with about asking questions. Bracha, you were speaking about it in the realm of halacha, but taking it over to the medical side for a moment. Women are constantly hearing about new treatments, supplements, all kinds of things that may or may not be helpful. So number one, how do you recommend that women evaluate what they're hearing? And number two, what kind of tips do you have for them, or how can you encourage them to bring their questions to their medical provider?
Yes, thank you.
Sorry, Michelle, you just muted yourself.
No, I think I just
Oh.
Can you hear me now? Okay. I think first and foremost is to know your body, to know what's normal for you, and then to be able to appreciate what is abnormal. So if you're going along and having a normal menstrual cycle, and then suddenly you have a period that lasts 2 weeks, that's obviously not normal for you. Is there sleep disturbances that are affecting your ability to work? Are you having more depressive symptoms because of it? Are you having situations with your partner where you're avoiding having relations or anything intimate with your partner because you have pain, but you don't want to broach the subject? Are you experiencing pressure, irritation vaginally again, and you don't want to broach the subject? So these are things that you start to think about, what's normal for you, and appreciate when something abnormal is happening. But most importantly is you have to ask the questions, right? So Bracha was saying that, ask the question, ask the question. So once you have this box filled with questions, now you're going to go to your doctor and you have your regular routine exam, and your doctor is pressed for time because he's only got, this one slot, and you're in there for a regular checkup, but you have concerns. What's really important is to make the most of that time that you're with that person, with whoever your provider is. And so start your visit by saying, yes, I'm here for my regular checkup, if you are, and I have some concerns I want to discuss with you. And that way, when you bring up those subjects, your physician or whomever it is will be addressing them as they're examining you. One thing that I personally, as a provider, find very challenging is I say, is there anything going on? We go through the whole visit. And then at the end, after the patient has been examined, then she says, oh, by the way, I'm having X. And then we're at the end of the visit. We have to go back again and re-examine and make sure that we're talking about the same thing. And it's not in the patient's best interest. It's not in my best interest. I can't help the patient as much if I don't know what the problem is. Now, hopefully the doctor has pointed out something to you, right? Hopefully they've said, yes, I see that you have X, and this is what we could do. These are the options that we have to treat it. But it is important to address them head on when you have your visit. The other thing I think is very, very challenging is in this time where everything is electronic, we're all surfing the web, we're all looking for these new therapies. There's I'm getting on Facebook, 50 million ways of how to lose weight. You got this diet, this diet. And you're like, well, how do I know what's real? So, and I think I'm not sure who mentioned it earlier, or maybe Audrey, you did, but the North American Menopause Society, I happen to think is a great site because they have a login for physicians, but they also have a patient login, not a login, but a panel that you can go scroll down as a patient as opposed to a physician. And they have something called Meno Notes. And what's good about it is these are little synopses on topics that we're all concerned about in menopause. So there might be a little blip about hormone replacement. There might be another little blip about sexuality, another one about osteoporosis. And so they have lists of these and they update them periodically. And they're written by professionals who are addressing those specific issues in menopause. So I think they're really, really helpful. The other thing that they have, which I personally enjoy, is that they have a list of videos that they're listed by year of when they came out. So you'd have to open up the year and then see what the videos are. And they're interviews from the member of the NAMS, North American Menopause Society, with a person who is well respected in that particular field. And so you can hear these conversations, these interviews, and they're only about 10 minutes long, and they're really very enlightening. And the other thing that you can find on the website is that they then have links to other areas that might be of interest of many of the things that we've talked about today. Now, one of the things that I think is important to address is when you see something about a new therapeutic remedy or a new device, you have to do your due diligence on them. So is the device FDA approved? Is it even FDA cleared yet? Has it been promoted by a professional society? And the one that it's like sometimes you have to read between the lines because they'll say, oh, we found statistical significance in this study. And then when you open it up, you find that they tested 30 women. Well, there's hundreds of millions of menopausal women in this country, right? Or women. And so to have something that said, even the Women's Health Initiative study, that they fell short of a few of the metrics that we were hoping for, they still had tens of thousands of women. And so they have continued to use that data to come up with new guidelines, like the most recent guidelines for hormone replacement therapy. So I think you just have to be really, really careful about it and use these other organizations as a sort of a way to access additional information.
Super. Thank you so much, Michelle. And I think there's a link, right? Hi, there's going to be a link to the association, National Menopause Association you mentioned in the chat. All right, turning to you now, Suri and Bracha. When women are actually going through menopause or finish going through menopause, there can be a lot of, I imagine, unexpected feelings about Harat Mishpacha, not going to the mikveh anymore. And I was wondering if both of you could address those. Bracha, we start with you.
Sure. So I remember once giving a refresher course, and I was talking about one of the very famous approaches that's presented as to a motivation, if you will, about why we keep Taharat Mishpacha. And it's an approach presented by Rabbi Meir that Nida enables a couple to really spend more time together physically at a certain point in time, and then they're separated so they can spend a little bit more time emotionally together, and it keeps things fresh. And following this, I shared that for some couples, this up and down really works. This time on, time off works. For other couples, it's not necessarily an approach that works, because some couples might find that they have limited time together. Also, with birth control now and stressors, running to the mikveh, it might be a little bit challenging for people, and they may appreciate a little bit more time in between mikveh experiences. And afterwards, one woman came up to me and told me that she really finds that ebb and flow of Nida really keeps things fresh, and she doesn't want to be in a menopausal state any earlier than she really needed to be. And I find that for some women, they really appreciate the experience of going to the mikvah, and they appreciate the impact that it has on their marriage. And so when they're no longer using the mikvah, and there's more time in between mikvah, and then it stops altogether, they actually miss it. And this is even for women who are using birth control, where they don't necessarily get their periods monthly, and they're not necessarily using the mikvah monthly, because they tell me that there's a big difference between actively choosing to not go to the mikvah by using whatever birth control you're using, versus that choice being forced upon you by menopause. And women who may not have necessarily appreciated mikvah at all tell me that they really miss it. So something that I encourage women is that as they're finding that their mikvah use is being reduced, perhaps utilize that each experience, or think about each experience almost as their last. So that in a sense, you can almost say goodbye to the mikvah at some point. Women doesn't really know when she's going to stop. She doesn't really know when she's going to stop using the mikvah, but to think about each time perhaps as the last time. Some women I find are feeling very relieved, and that also feels sometimes strange to them, because they may be at the end going to the mikvah a lot, because either they're assuming that stains are a problem, or they really, really do need to go to the mikvah a lot, and there may be a sense of relief. And then women call me up and they say, do I feel guilty? Is something wrong with me that I don't miss going to the mikvah? And I say, no. As Michelle was saying, each woman is a little bit different. You know what works for you and what's good for you. So that the same is true with the mikvah. Some women love going to the mikvah and they really miss it. And some women feel that they don't miss it. And I think that whatever a woman's feeling towards mikvah, that's something that's her own, that's something that's very personal. And a woman should feel comfortable feeling what she feels because that's her own feelings. But I also find that women call me and they tell me that their intimate life, I know Suri will address this much more, they share with me that they often find that perimenopause, menopause, it's very disruptive for them. And they miss sort of that regulation. And now they kind of, now it's not there anymore. And they call me up and they want to know, how do I keep things more exciting? How do I keep things more interesting? And I think that's something that Suri can address much more, but these are the things that I find women's connection to the mikvah and the changes that they feel, the fact that they're not practicing Taharat HaMishpacha, which was such a part of their lives for so many years. It's something that just kind of ends and it can feel very abrupt. And also the impact that has on their relationship with their husband and their relationship, that they kind of feel like this was their mitzvah, right? We always talk about Taharat HaMishpacha as a woman's mitzvah, and now they're not doing it anymore. And a piece of that, they share with me sometimes, that piece of womanhood connected to Taharat HaMishpacha that they no longer have is something that they miss, and some of them didn't anticipate it.
Thank you so much, Bracha. Suri, turning to you.
First of all, Bracha, I want to say thank you so much. I almost started to cry when you were talking about experiencing the mikveh as this may be my last time, and what that feels like when it's been such a part of your life for so long. And I totally appreciate the sensitivity that you brought to that whole description of what that's like for people. There is an identity factor about spirituality and sexuality that is embodied in mikveh usage. We are so blessed to have this for so many years as part of our lives. I have so many clients who are not Jewish, who did not get positive messages about being a woman and being a sexual woman. And I have to say that I really think as Orthodox Jews, we have done a good job. We have created a system that celebrates sexuality. It celebrates it. That's, all the research now is about mindfulness. Like, how can you improve sexual ecstasy? So a lot of books are coming out now about mindfulness and slowing down and tuning into your experience. And if you think about mitzvah preparation, and that's what we're asking people to do, like, take a break from all the crazy in your life, spend time with yourself, spend time alone with your own body, where you prepare yourself to then have this completely sensory experience in a body of holy water, right? It's like an amazing thing. And so when that is no longer a part of your identity, how do you hold on to that and integrate that into a new kind of wiser, that's how I like to think about menopausal women, that they've achieved a level of wisdom about their experience. And actually, our bodies are repositories of memory. So there's a branch of psychotherapy called somatic psychotherapy, which deals with the body's memory of experience. And if you think about mikveh usage and then its connection to intimacy with your partner, it really creates layering of somatic memory in the body for a sensual experience. And when you're in menopause, that doesn't go away. You have all of that stored inside of you. So it's that, but now it's like, now I can look back and say, I did all that. My body did all that for me. And now I'm available for a physical touch with my partner in a more accessible way than I've ever been before. And so that's a way to kind of think about it, that experience of sensuality and sensory touch can continue with a partner going forward without the limitation. But just on another note, I will say, I have had women in my practice who, even during pregnancy, when they weren't getting their periods, decided to do an on and off cycle as a way of maintaining kind of erotic anticipation. Because that's the whole counting down, we count towards. So it's like that erotic anticipation primes the body for an experience which people really do enjoy. And they try to recreate in other ways once they can no longer go.
Thank you so much, Suri. Again, I just want to pick up a little bit on something you've said, and both you and Michelle have touched on this in different ways earlier, but maybe we can just dive a little deeper into the topic of our bodies and the fact that sometimes we don't discuss is our bodies age and change, as do our partners. And how does that fit into our experience during menopause? How we reflect on our own aging bodies and those of our partners. Suri, you want to start with that? And then we'll take it over to Michelle. Thank you.
Sure. We have a relationship with our bodies. Like, it's really kind of a funny thing, like to say you have a relationship with your own body, but you do, just like you like things or you dislike things, or you think this is cool or that's not cool. Once we get older, it is extremely important to not criticize your body in the same way that you do not treat your body worse than you would a good friend, right? You wouldn't go over to a good friend and say, hey, you're kind of saggy today, or it looks like you put on a few pounds, or, right? We need to treat our bodies with kindness, and the power of our own narrative and what we tell ourselves about ourselves is I think, one of the single most powerful forces that we have. So that if we are kind to ourselves and appreciate everything our bodies are able to do, and they're still able to do, it definitely reinforces that kindness and gratitude. And partners, if you're in menopause, odds are your partner is also aging, right? Hopefully. And they're going through their own experience of changes in their body. And a lot of those changes affect male sexuality. So to be kind and generous with each other about those changes, and to be able to, like I said before, bring humor to the situation is extremely important. It's like if something doesn't go well, you can be disappointed, but try not to be devastated and not to make your partner feel devastated by, let's say, an erection that didn't last, or an inability to get aroused at all, right? Because there is a lot of wonderful sexual connection that can happen with bodies that are just functioning differently. Different is not bad, it's just different.
Thank you so much, Suri. I see that we really pushed into our Q&A time here, and I want to make sure that we do get to the questions and answers. Michelle, did you have anything brief that you wanted to add to that about aging bodies?
1 or 2 minutes.
Okay.
So I think, and Audrey, you mentioned this earlier, that there's like not a lot of negativity around menopause and, oh my God, what's it doing to my body? And I think what's important to keep in mind is that, and Suri touched on this also, that there are so many less distractions for us as couples when we're alone in our home, when we don't have children there, when we're not worried about getting pregnant, when we're not bleeding anymore. We have a lot more opportunities to connect with each other. Now, that being said, aging is aging. medical conditions occur. Things happen, of course, erectile dysfunction, the vaginal issues that we've already touched on, and real medical problems. Heart disease, arthritis makes things challenging, dementia, depression, diabetes, all of these things factor in. But I think that if we keep in mind to try to find new ways to connect with each other in an open and honest way and to constantly be communicating, I think we can redefine what that relationship looks like and try to view menopause as not the end of your feminine self, but that you can see the beauty of both of your aging bodies. And I am a big fan of laughter and smiling. And so I think that is like the number one ingredient in a successful, happy, thriving, really, through menopause.
Thank you so much, Michelle. Before I turn it over to the Q&A, I just want to, number one, thank our wonderful panelists, Bracha, Suri, and Michelle. So many great takeaways, lots of information. And I don't think anybody minds that it went a little bit over because there was just so much to learn from and appreciate. I want to also just amplify what Michelle just said at the end there about reframing perhaps our attitudes about menopause. I hope this program has helped in that regard. And I certainly also hope that we've all been encouraged to ask questions, advocate for ourselves, whether it's with our medical professionals, or yoetzet halacha, or a therapist. But that is a great way to get more information and to feel validated, and also hopefully start your journey in a positive way during this life stage. And with that, I would like to now turn it over to Julia, who will lead the Q&A.
Great, thank you so much. Hi everyone, Julia again, and I'm going to be helping to moderate the audience Q&A. I want to thank Audrey for moderating the panel so seamlessly and for sharing her own wise thoughts. I want to thank our panelists for sharing so much of your own wisdom and experience with us. We're grateful that our speakers have agreed to take some of the questions from the audience that came in on the chat. But first, we're going to be putting a link in the chat in case anyone would like to make a contribution in support of tonight's program or future events like it. The link will take you to our mikvah's website where you can make a contribution to our education fund. We're also reposting the survey in the link now. You can continue to post questions in the chat, and we will do our best to get to as many of them as we can. So let's get right into it. The first question that we have is, I think, for Dr. Klein. If a woman does not want to take hormone replacements, what are the hormone-free options to relieve symptoms?
So the real question is which symptoms? There are non-hormonal medications that can be used, for instance, for hot flashes, if we're talking about hot flashes. There are formulations of, for instance, antidepressants, which can help with hot flashes. There are medications now that are related to hormones, but are not specifically hormones. So those are very useful. There are also, depending upon what the symptom is. So that would be for hot flashes. If someone is experiencing the vaginal symptoms of dryness and pain, or even urinary symptoms, then there are a multitude of non-hormonal, non-estrogen containing medications that can be purchased over the counter, or even a very, very low dose of topical anesthetic can be used. Hyaluronic acid in capsules is often used, and even coconut oil works very well. So to answer that question fully, it really just depends on what the symptoms are.
Okay, thank you so much. Another question that we have, which I think maybe everyone might have some thoughts on, is what can we do to change the general negative perception about menopause? In your 40s, you start to hear all the negativity about menopause, which has an effect on your psyche. Any thoughts, anyone? Maybe Suri, we'll start with you.
Well, first of all, you can go see the show Menopause the Musical. Has anybody seen? It's a lot of fun, and it takes away, and you'll just laugh. It's just fun. So, but if you can't do that, I think some of the negativity is really anxiety based. I was thinking about this, that it's because when I was in my 20s, honestly, I went to a program at my shul where the topic was menopause, and my friends and I left, and we were like, oh my gosh, this is going to be a disaster. Like, it was just awful. And I think that what happens is, what is a classic definition of anxiety is an overestimation of threat and an underestimation of your ability to handle it. Got that? Like, overestimation of threat, underestimation of my ability to handle it. Everybody can handle menopause. Women have been handling it for centuries, right? You're going to be okay. You're going to navigate the waters. It's a change. It's a natural, normal change that everybody goes through, and it has some real benefits. And we've talked a lot about them this evening. I actually think it'd be great if we could change the name. Menopause is honestly an erotic killer as a word. And I think it should be something like free power, or something that represents women's freedom from having to deal with menstruation. So that's my suggestion.
Great, thank you. Okay, so this next question is I think maybe specifically for Bracha. Oh, there we are. And I don't know, Bracha, maybe if you could just give us some, maybe give the questioner some guidance about maybe where to go for this type of question. It is multi-part, so we'll start with the first part. And so the questioner asks, we're talking about women, but of course, as we get older, so do our husbands. As men get older, is there any halachic reason that they shouldn't be allowed to take Viagra?
So there may be different opinions, but according to most halachic authorities, Viagra is okay, or any other medication for erectile dysfunction. You do have to be aware of when you're taking it and all of the directions and guidance that you get from a doctor, so that you don't necessarily run into issues of potentially wasting sperm, because a man will have an erection soon at a certain point, and it may last longer, and the couple really has to be prepared for having sex when the man takes Viagra. And that's, I guess, where perhaps Suri's idea about different types of arousal can come in, but the couple really has to plan it and schedule it so that they don't run into any potential halachic issues. But most from a halachic perspective, it's not according to most poskim, it's not a problem to take Viagra.
Thank you. The second part of this question is as follows. Also, if either or both of them isn't interested in medications or procedures to enable them to have intercourse, or if intercourse is painful, difficult, or uncomfortable, from a halachic perspective, are they supposed to refrain from intimacy if the man will end up releasing his sperm outside of the vagina?
So this is where consulting with a halachic authority and also consulting with perhaps a medical professional, a sex therapist, can be very important, because this would be the type of situation where I might consult with a woman's doctor or talk to them about what is exactly is needed. Yes, she might not want to go the medical route, but we do need to determine, would this be a situation where there would be other types of intimacy, or would this be a situation where he could end up, we could do other things or find other alternatives, and there may be room. This is an area where it's really important to ask a question. It's hard to give broad advice because this is where the personal that I was talking about earlier, the personal situation really comes into account. There may be lots of other factors that play a role in all of this, and that's where it becomes very important to include as much information in the question so that I can give, with the post-game that I work with a therapist, with a medical doctor, in terms of giving the best advice to a couple of what they should be doing, what they can be doing. And it's important to go ahead and ask a question in this type of situation.
The final part of that question, I apologize for missing it, and this will end our Q&A. We didn't get too many in. What are any sort of halachic concerns with using a condom in that situation?
There are, so whether it's permitted or not, another situation where we need to go ahead and consult with the halachic authority. That's where I would consult with post-game. The main issues with a condom are the fact that the sperm will not be entering into the vaginal tract, and that there is interference in the normal way or the typical way that intercourse is, because the condom goes ahead and is a barrier between the penis and the vagina. So those are the two halachic considerations. There may be room for leniency in very specific situations, and this is where it's important to go ahead and ask a question and to go ahead and provide as much personal information as possible. And again, consultation might be helpful in this case to know exactly what the situation is and what other factors are playing a role. If a woman calls me up and says, "Can I use a condom?" It's a very different type of situation than if a woman calls me up and says, "I'm going through X, Y, and Z situation. My husband and I are having these challenges." The answer may be very different. And that's where the personal information and providing that personal information is very important.
Thank you. And with that, that was our last question. I want to thank our panelists for staying on longer than expected, our participants, our audience for staying on longer. I want to thank everyone for participating and for attending. The recording of tonight's event will be available within a few days on our website, mikvaamuna.com. If you have any comments, please feel free to email us at comments@mikvaamuna.com. Please fill out the survey if you haven't already. And once again, Audrey, Suri, Michelle, Bracha, thank you for this wonderful talk. Thank you all and have a great night.
Thank you, Julia. Good night.
Thank you so much.
Thanks, Julia. Thanks so much.
Julia and Audrey, sorry, Michelle. Thank you.
Thank you.
Thanks, everybody.
Good night, everyone.